Alprazolam, commonly known by the brand name Xanax, is a short-acting benzodiazepine primarily used for generalized anxiety disorder, panic disorder with or without agoraphobia, short-term relief of anxiety symptoms, and adjunct treatment for depression-related anxiety. Off-label uses include insomnia, premenstrual syndrome, and alcohol withdrawal. Common side effects include drowsiness and dizziness, fatigue, impaired coordination, slurred speech, and dry mouth. Serious side effects include respiratory depression, severe sedation, memory impairment, paradoxical reactions such as aggression and agitation, withdrawal symptoms like seizures and rebound anxiety. Alprazolam works by binding to benzodiazepine receptors on the GABA-A receptor complex, increasing GABA's inhibitory effect. This results in sedation, anxiolysis, muscle relaxation, and anticonvulsant properties. The dosage for anxiety disorder is 0.25 to 0.5 milligrams orally 3 times daily with a maximum of 4 milligrams per day. For panic disorder, 0.5 milligrams 3 times daily with a titration of up to 10 milligrams per day in severe cases. For elderly or debilitated patients, the dosage starts at 0.25 milligrams twice or thrice daily. Alprazolam is available in different forms, including immediate release tablets, extended release tablets, oral disintegrating tablets, and oral solution. Alprazolam interacts with other medications resulting in increased sedation and respiratory depression. Avoid combining with other CNS depressants like opioids, alcohol, and barbiturates. Muscle relaxants and antihistamines. Inhibitors of CYP3A4 increase alprazolam levels. These drugs include ketoconazole, itraconazole, ritonavir, and fluoxetine. Inducers of CYP3A4 reduce alprazolam levels. They include carbamazepine and phenytoin. There are precautions to consider when using alprazolam. It has a high potential for abuse, especially in patients with a history of substance use disorder. Withdrawal symptoms can be severe. Dose should be tapered gradually. Respiratory depression risk increases with opioid use and in patients with respiratory conditions. It can cause CNS depression. Avoid activities requiring full alertness like driving and operating machinery. In pregnancy and breastfeeding, it is classified as Category D. There is a risk of fetal harm and congenital defects. Avoid during breastfeeding as it is excreted in breast milk. Alprazolam overdose can cause extreme drowsiness, confusion, respiratory depression, hypotension, and coma. Overdose can be managed with airway support for severe cases with flumazenil, which is a benzodiazepine antagonist, and also with intravenous fluids and symptomatic management. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.